Senators, thank you for the opportunity to appear this morning and to discuss with the committee some of the issues relating to out-of-pocket healthcare costs facing consumers across occupational therapy services. My name is Peter Bothams and I'm here today in my capacity as Vice President of the Board of Occupational Therapy Australia. And here with me is also Dr. Kieran Broome, who's the Chairperson of the Queensland Division of Occupational Therapy Australia. Occupational Therapy Australia is the professional association and peak representative body for occupational therapists. As of April 2014, there are 16,000 registered occupational therapists working in Australia. By way of background, OTs, occupational therapists, are health professionals whose role is to enable their clients to participate in meaningful and productive activities. Occupational therapists are part of the allied health workforce and work in a variety of settings, including private clinics, schools, aged care facilities, hospitals, universities, rehab services, mental health services, community health centres, medical clinics and local government agencies. We work solo and also as part of broader allied health teams. OTs provide healthcare, vocational rehab, physical and mental health therapy and serve the community through a number of state and Commonwealth funded, government health funded initiatives. It is our role in the delivery of these Commonwealth funded programs and the out-of-pocket expenses our clients face in these programs that is the focus of our submission and will be the focus of my remarks today. After surveying our membership, it was quite clear there were three specific Commonwealth-funded initiatives through Medicare that our members believed had the most significant out-of-pocket costs. These were chronic disease management and the delivery of services such as home modifications, better access to mental health care and access to allied psychological services. Our submission details a number of areas where costs are not covered in the existing 20 to 30 minute rebatable session structure. That includes researching the best equipment for the person, report writing, travel to client locations and home visits, and also follow-up visits. They are important aspects of our service delivery and built into our fee structures, which often are higher than the government's rebate. These and many more costs are often passed on to clients and become out-of-pocket expenses. Our submission also provides a number of recommendations that, once implemented, would also be a good first step in addressing these consumer out-of-pocket expenses. One practical measure is government facilitating greater stakeholder involvement in understanding the real costs of providing these services to the community, particularly those consumers in rural and remote areas. Occupational Therapy Australia believes the government needs to initiate more opportunities for providers to engage with government around the actual costs of service delivery. This can be done, we believe, within existing structures such as Medicare Local or Primary Health Organisation, using them in this feedback process to ensure that OTs and other allied health professions can have routine and regular feedback around the delivery of services in local communities would be an effective local way of sorting out the problems in service delivery. Though we did not specifically refer to the government's proposed GP levy in our submission as it was completed before the budget, Occupational Therapy Australia has since commissioned research into the impact we believe it will have on OT and broader allied health services. Occupational Therapy Australia is concerned that increasing the out-of-pocket costs for primary health care will discourage those who are most in need but unable to afford it from seeking treatment from a doctor. This may have significant repercussions for our patients who at present can only access our Medicare rebatable services via a GP referral. Thank you again for the opportunity to appear this morning. Occupational Therapy Australia believes that together with the correct action we can address these out-of-pocket expenses for consumers and ensure the longevity of these programs, and Dr. Broome and myself are happy to address any further questions the committee might have.